Assalamu alaikum wa rahmatullahi wa barakatuh. Our lecture today about parasitic infections of the lung. Objectives: identify the parasite that infect the lungs, scientific name and common name of the parasite, geographical distribution and normal habitat. Describe the morphology and internal organelles of the parasite. Understand the mode of infection. Describe the life cycle. Define reservoir host. Define incubation period. Discuss pathogenesis and symptoms of the disease. Explain the methods of diagnosis and describe the treatment. Parasitic infections of the lung may occur worldwide among both immunocompetent and immunocompromised patients and may affect the respiratory system in a variety of ways. Pulmonary fluke includes Paragonimus westermani. The common name of this parasite is Oriental lung fluke or Japanese lung fluke. Disease: Paragoniasis. It is the major species of lung fluke that infect humans, most common in Eastern Asia and South America. Adult fluke lives in fibrous capsule in the lung and other tissues of the body. Morphology. This is the adult fluke of parasite Paragonimus westermani. It is stout, mumtali'a, reddish brown in the living state. Contain both male and female genital organs in the same fluke. The oral sucker and ventral sucker, which is called also acetabulum, with the same size. At the posterior portion of the body, we can see two lobed testes adjacent from each other. There is one lobed ovary in the center of the fluke, behind acetabulum, and there is coiled uterus. We can see excretory bladder extend from the posterior portion of the body to pharynx. Eggs. They are yellow-brown, ovoid or elongated, with a thick shell. The ova has two membranes and one end slightly flattened. In the anterior portion of the ova, we can see operculum. The eggs at the time of oviposition are unembryonated, when passed in sputum or stool. Life cycle. Infection occurs when human ingest undercooked or raw meat of crustacea, crabs or crayfish containing metacercaria. Exustation occurs in the duodenum, and metacercaria liberate and convert to adult fluke. In the lung, lay eggs. We can see eggs either in sputum or in the stool when sputum is swallowed. We say that eggs at the time of oviposition are unembryonated. Which means don't have embryos. These eggs need aquatic media, and after a period of time, about 15 days, eggs will have embryos, which is called miracidia. Hatch from eggs and swim to find the first intermediate host, which is suitable snail. Miracidia penetrate snail and convert to the larval stages, sporocyst, first generation of radia, second generation of radia, then convert to the larval stage, cercaria. These cercariae leave the first intermediate host and swim to find the second suitable intermediate host, as we said, crustacea, such as crayfish or crabs, and repeated the life cycles. Transmission. Transmission occurs through the consumption of raw or undercooked seafood. In Asia, an estimated about 80% of freshwater crabs carry this parasite, Paragonimus westermani. Reservoir host, which is the host that may contain the infectious agent. This infectious agent could multiply and development, or just multiplication occur, or just development occur to this infectious agent in the reservoir host. This host essential for keeping parasite when active transmission is not occur. Animals such as pigs, dogs can also harbor this parasite. Incubation period, which is the period between exposure to an infection and the appearance of the first symptoms of disease. In our parasite, time from infection to oviposition takes about 3 months. Infections may persist for 20 years in a human. Pathogenesis and symptoms. Acute manifestations includes acute pulmonary infection characterized by low-grade fever, cough, night sweat, chest pain, and blood-stained rusty brown sputum. Chronic manifestations includes lung abscess or pleural effusion, develops in individuals with chronic infections. Fever, hemoptysis, pleurisy pain, dyspnea, and recurrent attacks of bacterial pneumonia are the common symptoms. This condition is similar to pulmonary tuberculosis. Fever, headache, nausea, vomiting, and visual disturbances, also localized or generalized paralysis, are the main symptoms of cerebral paragoniomyces. Capsules in the heart can cause death. Diagnosis. The eggs of this parasite are characteristic and may be seen under microscope in stool specimen, brown sputum, lung fluid, cerebrospinal fluid, but these are not present until 2 to 3 months after infection. Other type or other way of diagnosis is chest X-ray, may show nodular cysts and pleural effusion. Blood test is also available to detect eosinophilia, which is often associated with parasitic infections. Lung biopsy can also be used to diagnose this parasite. Also, serological test, in particular, enzyme-linked immunosorbent assay method, is useful diagnostic test. Treatment. The drug of choice is praziquantel to treat disease paragoniomyces. The recommended dosage of 75 mg for each kilogram per day, divided into 3 doses over 3 days. And the alternative drug is bithionol. But the side effects include skin rash and urticaria. Epidemiology. The epidemiology of this disease depends on one of the followings: existence of appropriate snail, crabs, and mammalian reservoir hosts in the area, pollution of snail habitat with sputum and feces of human, consumption of metacercariae through eating of raw or undercooked crustacea, or through contamination of the fingers and cooking utensils with metacercariae while cleaning. Control. Avoid eating fresh crustacea and proper waste disposal. The second parasite is pulmonary hydatid disease, hydatidosis, caused by parasite Echinococcus granulosus. Intermediate host human and definitive host canidae. Habitat of definitive host small intestine, while habitat of intermediate host all organs except hair and nails. Larval stage called hydatid cyst. Although most cysts form in the liver, about 20 to 30% form in the lung following the rupture of liver cyst. Pathogenesis and symptoms. Clinical pulmonary manifestations include cough, dyspnea, chest pain, and fever. Rupture of hydatid cyst into bronchus may result in hemoptysis, dyspnea, persistent pneumonia, anaphylactic shock, sepsis, and asthma-like symptoms. Rupture of hydatid cyst into pleural space may result in pleural effusion, empyema, and pneumothorax. The other parasite is Dirofilariasis, caused disease Pulmonary Dirofilariasis. Intermediate host is mosquito. while definitive host canidae and human. Habitat of definitive host lung arteries as well as the heart. Infective stage to mosquito is microfilaria, larva 1. In humans, worm fail to mature and is swept away to peripheral pulmonary arteries. Pathogenesis and symptoms include chest pain, cough, hemoptysis, wheezing, fever, chills, and malaise. This is the image of adult female, which is larger than male, and this is the image of microfilaria. Pulmonary amoebiasis. The causative agent of this disease is Entamoeba histolytica. Definitive host, human. Habitat of definitive host in the large intestine. Infective stage is the cyst stage. This is the trophozoite stage, consists from large nucleus with central karyosome. We can see clear ectoplasm and granular endoplasm, contain vacuoles, food vacuoles. Inside these vacuoles we can see RBCs, and also this stage has pseudopodia, which are extensions from ectoplasm. This is the cyst stage of this parasite. Spherical, contain 4 nuclei, and large chromatoid body, has cigar shape. Pathogenesis and symptoms. Active trophozoites can be identified in stool or sputum or pleural specimen. Physical examination reveals fever, chest pain, hepatomegaly, and cough are indicated pleuropulmonary amoebiasis. Some patients may present hemoptysis and dyspnea. The other disease in the lung is Pulmonary Ascariasis, caused by the roundworm Ascaris lumbricoides. This is the female, larger than male, and this is the image of ova. This parasite can produce 2 types of ova: fertilized and unfertilized. The fertilized ova can complete the life cycle. It is spherical and smaller than unfertilized ova, which can't complete the life cycle, and larger with ovoid shape, larger than the fertilized one. This parasite present in the intestine, so we can see the ova and detect it in the stool. After shedding ova, knead soil, convert to ova with larvae. Infection occurs through eating vegetables contain ova with larvae. and complete the life cycle. Pathogenesis and symptoms. Symptomatic pulmonary involvement may range from mild cough to Larval syndrome, which is self-limiting lung inflammation and associated with blood and pulmonary eosinophilia. Respiratory symptoms may include chest pain, hemoptysis, shortness of breath, and wheezing. Pulmonary Ascariasis may be caused by the hookworm Ascaristoma duodenale or the hookworm Necator americanus. Filariform larvae enter the human host via the oral route, also able to penetrate the skin of the human host, and it can reach pulmonary circulation. The habitat of this parasite in the intestine of the host, which is a human host. We can detect the ova in the feces, ova in the environment. After a period of time, contain larvae, rhabditiform larvae, hatch from the ova and convert to the infective stage, which is filariform larva. This filariform larva can enter the body through the oral route or through penetration of skin. This is the head of this parasite, Ascaristoma duodenale. And this is the buccal capsule, contain 2 pairs of teeth. Pathogenesis and symptoms. Bronchitis and bronchopneumonia can occur when the larvae penetrate pulmonary capillaries to enter the alveolar spaces. Cough, fever, wheezing, and pulmonary eosinophilia could occur. Necator americanus also the same life cycle to Ascaristoma duodenale, but there is a single difference between life cycle of Ascaristoma and life cycle of Necator americanus. Here in Necator americanus we can see the filariform larvae infect a human only through penetration the skin and not by the oral route. Pathogenesis and symptoms includes bronchitis and bronchopneumonia. This is a real image of this parasite, Necator americanus. This is the anterior portion. This is the mouth of this parasite, contain cutting plates. Pulmonary larval migrans caused by Toxocara canis and Toxocara cati. Paragenic host is a human. Paragenic or transport host is a host that serves until the appropriate definitive host is reached. The parasite can't undergo to any other stage. The parasite can't undergo any development but remains alive and infective to the final host. يعني إذا المضيف كان يحتوي على الطفيلي في حالة الأدلت فيبقى هذا الطفيلي كما هو في حالة الأدلت، ما ممكن أنه يتحول إلى شكل آخر. إذا أخذ مثلا الطفيلي في حالة اللارفال ستيج كأن تكون لارفا، تبقى هذه اللارفا على حالها ولا تتحول إلى شكل آخر. This is the life cycle of the parasite Toxocara canis. Adult worm in the lumen of intestine, so detection of this parasite by seeing eggs in the stool. Eggs need time to become embryonated egg, which means contain larvae. Either enter the same definitive host, which is the dog, and complete the life cycle, or these embryonated eggs infect mammalian, include human, hatch larvae from this egg and remain larvae in tissues, can't convert to other stage. As we said, in this parasite, human is paratenic host for this parasite. Pathogenesis and symptoms includes pulmonary manifestations are found in about 80%, and patients present with severe asthma and bronchitis. Toxocara cati male contains structure called cephalic alley in the anterior portion. Eggs are pitted because the layers of proteins around the oval. Pulmonary Leishmaniasis. Pulmonary or visceral leishmaniasis, also called Kala-Azar, is caused by Leishmania donovani, is transmitted by various species of phlebotomus, which is a type of sandfly. Pathogenesis and symptoms include pleural effusion and pneumonitis, have been reported in HIV-infected patients with visceral leishmaniasis and lung transplant patients. This is the life cycle of Leishmania. The infective stage is promastigote, found in sandfly, phlebotomus. When this sandfly takes blood meal, it will give this infective stage, promastigote. This promastigote taken by macrophage for phagocytosis and convert to the larval stage amastigotes. Amastigotes multiply in the cells of various tissues and infect other cells. When sandfly takes blood meal, it will take this larval stage, amastigote. And then ingestion occur to this larval stage, convert to promastigote in the gut. divide in the gut and migrate to proboscis, and life cycle repeat. In this image, we can see a mastigote stage in the macrophage. While promastigote of Leishmania donovani, we can see it in the culture and in the insect itself. Pulmonary Trypanosomiasis, caused by Trypanosoma gambians, Trypanosoma rhodesians, and Trypanosoma cruzi. Pathogenesis and symptoms. In mice model, hypercellularity and edema of alveolar walls approximately 10 times thicker than normal alveolar wall. These pathogenesis can contribute to pulmonary alveolar hemorrhage, bronchiolitis, and pneumonitis. Pulmonary emphysema, انتفاخ الرئة, was also observed in the lungs of infected rats. This is the life cycle of a Trypanosoma species. Infection occurs to human through the bite of the insect tsetse fly. This insect infected with the infective stage of this parasite, which is metacyclic trypomastigote. This stage transforms into bloodstream to trypomastigote, carried to other sites. Multiplication by binary fission occur in various body fluids. And we can see this stage in blood. Infection occur to the tsetse fly after taking a blood meal containing the infective stage, trypomastigote. Go to midgut of the tsetse fly. Multiplication occur by binary fission. Leave the midgut and transform into epimastigote. Trypomastigote has large flagellum, nucleus in the center of the cell. Kinetoblast locate far distance from nucleus, while epimastigote has short flagellum, nucleus in the posterior portion of the cell, and kinetoblast very close to nucleus rather than trypomastigote. This epimastigote multiply in salivary gland, then trans to the infective stage, which is metacyclic trypomastigote, and life cycle repeated. Pulmonary Babesiosis. This disease is caused by parasite Babesia. A human is infected by the bite of infected tick. Genus Exodus. طبعا التك هو نوع من الحشرات. العائدة إلى علم الحشرات الانتمولوجي. or by contaminated blood transfusion. فإذا هذا الديزيز البابيزيا ممكن حدوثه بطريقين. الطريق الأول عن طريق bite of infected tick. infected tick بمعنى الحاوي على طفيل البابيزيا. الطريق الثاني يكون عن طريق contaminated blood transfusion، يعني شخص مصاب بالبابيزيا ويعطي الدم لشخص آخر، فراح يحدث انتقال الطفيلي بهذه الطريقة. This parasite can attack the RBCs and lead to misdiagnosis of Plasmodium parasite. يعطي أعراض شبيهة بأعراض الإصابة بالملاريا المسبب له طفيل البلازموديوم. Pathogenesis and symptoms: pulmonary edema and respiratory distress syndrome, sporozoid, trans to trophozoid, then merozoid in RBCs of a human. Filarial parasites associated with tropical pulmonary eosinophilia. This syndrome results from immunological hyper-responsiveness to human filarial parasites. Washeria bancrofti and Brugia malayi. Intermediate host for this parasite is mosquito. Culex, Anopheles, and Aedes, while definitive host is a human. Habitat of definitive host in the lymphatic system. Infective stage, larva. Diagnostic stage, microfilaria in peripheral blood. Pathogenesis and symptoms. Clinical findings are cough, fever, and chest pain. This is the image of microfilaria of Washeria bancrofti. We can see this microfilaria covered with sheath. This is the anterior portion of microfilaria. We can see coarse nuclei along the body, and this is the tail of microfilaria. Pulmonary Strongyloidiasis, caused by parasite Strongyloides stercoralis. This parasite has the ability to produce free-living generations in addition to parasitic generations. Filariform larvae can directly penetrate the skin. These filariform larvae pierce the pulmonary capillaries, enter the alveoli, migrate to the bronchi, trachea, larynx, and epiglottis, then swallowed back into the intestine. Definitive host is a human. Habitat of definitive host in the intestine. Infective stage is filariform larva, converted from the molt of rhabditiform larva, which is the diagnostic stage in human. In these two images, we can see filariform larva and rhabditiform larva. Filariform larva, which is larva 3, slender and elongated, has delicate capillary esophagus and blunt tail. We can see the blunt tail, the pointer. هذا التيل اللي يحتوي على يكون مثلم. Rhabditiform larva, we can see it in the stool, shorter than filariform larva, and has bulb esophagus and pointed tail. Pathogenesis and symptoms includes bronchopneumonia and alveolar hemorrhage can occur. Most patients with hyperinfection present with cough, fever, and shortness of breath. انتهت محاضرتنا التابعة إلى الريسبيراتوري موديول واللي ضمنت parasitic infections of the lung. السلام عليكم ورحمة الله وبركاته.